Number 10. Hair, nails, and dead skin. You cut part of your body off every week and feel nothing. Hair, nails, the outer layer of your skin. All three are already dead. Your hair shaft is keratin. No blood, no nerves, nothing alive in it. The follicle underneath is packed with nerves. Pull a hair and you'll know instantly. But the strand itself is a thread of protein your body abandoned. Nails work the same way. The plate is dead. The bed underneath is not. That's why a broken nail is nothing, and a nail bed injury is agony. Your outer skin is about 20 layers of flattened dead cells. You are wearing a coat made of your own dead cells. You shed roughly 0.5 kilogram of them every year. Some of the dust in your room right now is you. It's the only part of you a blade passes through without a signal. Number 9. Tooth enamel. Enamel is the hardest substance your body makes, harder than bone, and it has no nerves in it at all. None. A dentist can drill straight through it and you feel nothing. The whole time, that drill is grinding through the hardest material you own. Then it reaches dentin. That's where everything changes. Dentin is threaded with microscopic tubes. Those tubes run down to the nerve. Cold water, sugar, even air moves the fluid inside them. The nerve reads that movement as pain. So the moment enamel wears through, your tooth stops being armor and becomes an alarm. That's what sensitive teeth actually are. Not nerve damage, exposure. And enamel doesn't grow back. Your body has no repair mechanism for it. Every bit you've lost is gone permanently. The hardest thing you own is the one thing you can never replace. Number 8. Your lungs. Take a breath. You just felt nothing. The deep tissue of your lungs has no pain receptors. The alveoli, the tiny sacs where oxygen crosses into your blood, are completely silent. You cannot feel them. This is part of why lung cancer is so dangerous. A tumor can grow inside lung tissue for years without a single signal. No ache. No warning. Nothing at all. It only starts to hurt when it reaches the pleura, the lining wrapped around the lung. That lining is richly supplied with nerves. So by the time the pain arrives, the tumor has already left the silent zone. That is one reason lung cancer is so often caught late. Your body had no way to tell you. The organ keeping you alive every 4 seconds cannot report its own damage. Number 7. Cartilage. Press the tip of your nose. Squeeze the top of your ear. That's cartilage, and it is built differently from almost everything else in you. It has no blood supply. None. And where blood doesn't go, nerves don't go either. The cartilage capping the ends of your bones is completely insensitive. It's a smooth, glassy surface that lets your joints glide without friction. You can wear it down for decades and feel nothing. It also means cartilage barely heals. No blood supply means no repair crew arriving. This is why arthritis works the way it does. The pain doesn't start when the cartilage is damaged. It starts when the cartilage is gone. Once that cushion wears through, bone grinds directly against bone. And bone is wrapped in periosteum, which is loaded with nerves. By the time your knee hurts, the silent part is already over. Number 6. The inside of your eye. The lens of your eye is transparent. So is the jelly behind it. Light has to pass straight through both without scattering, and that creates a problem. Blood vessels block light. Nerves block light, so your body built these parts without either one. The lens has no blood supply and no nerve supply at all. Neither does the vitreous, the clear gel filling the back of your eye. They are among the only living tissues in your body, with no connection to your circulation. The lens feeds itself from the fluid around it, and because there are no nerves, you cannot feel them. A cataract is your lens slowly clouding over. It can take years. You will never feel it happening. You only find out when the light stops getting through. Number 5. The lining around your organs. A thin membrane wraps everything in your abdomen. It's called the peritoneum. It comes in 2 layers, and they behave completely differently. The layer wrapped around your organs barely feels anything. The layer lining your abdominal wall, a few millimeters away, is one of the most sensitive surfaces in your body. Cut the outer layer and it's unbearable. Cut the inner one and there's almost nothing. 2 sheets of the same tissue, millimeters apart, wired completely differently. This is why appendicitis pain moves. It starts as a vague, dull ache somewhere near your navel. You can't point to it. It feels like indigestion. Hours later it changes. Sharp, precise, lower right. That's the inflammation reaching the outer layer. Surgeons use that migration as a diagnostic sign. Your pain relocated across your abdomen because it switched membranes. Number 4. The umbilical cord. Everyone watching this had a cord cut. Nobody felt it. The umbilical cord is an entire organ with no sensory nerves. It's 2 arteries, 1 vein, and a substance called Wharton's jelly holding them in place. That jelly is the whole structure. No muscle, no skin, no nerve supply. There are no pain receptors anywhere in it. So when it's clamped and cut minutes after birth, the newborn feels nothing. No anesthetic is used, because there is nothing to numb. The stump then dries, shrinks, and drops off over a few weeks. Also painless. It's the only organ your body builds knowing it will be severed. So it never bothered installing an alarm. Your navel is the scar left behind. It's the one wound every human being on Earth shares, and not one of us felt it happen. Number 3. Your liver. Your liver is the largest internal organ you have. It performs over 500 separate jobs. And it cannot feel a thing. The liver tissue itself has no pain receptors at all. You could cut into it and the organ would have no way to report it. What does hurt is the capsule, a thin fibrous bag stretched around the outside. That capsule is well supplied with nerves. So liver pain isn't the liver, it's the wrapper being stretched. This is why liver disease stays quiet for so long. Damage builds for years with no symptoms. Scarring accumulates. Function declines. Nothing hurts. The pain only arrives when the organ swells enough to push that capsule outward. By then, the damage is usually extensive. The organ filtering everything you consume cannot complain about any of it. Number 2. Your intestines. This one sounds impossible until you see the evidence. Your intestines are almost completely insensitive to being cut. Not numbed, not dulled. They barely register it. In 1902, a Swedish surgeon named Karl Lennander tested this directly. He operated on conscious patients and handled their intestines while they talked to him. He cut the gut. They didn't notice. Crushing, burning, pinching, all unbearable on skin, produced almost nothing. But your intestines are not painless. Stretch them and it is one of the worst pains a human can experience. Trapped gas, a blockage, a stone moving through the tube beside them. That is the same tissue that ignored a scalpel, screaming. Your gut isn't insensitive, it's sensitive to exactly one thing. And it isn't the thing you'd expect. Number 1. Your brain. Your brain is the reason you feel anything at all. Every pain you have ever had was assembled inside it, and it cannot feel pain itself. Not reduced, not dulled, none. There are no pain receptors anywhere in brain tissue. Surgeons rely on this. It's called an awake craniotomy. They open your skull, and you stay conscious the whole time. The scalp gets local anesthetic, because scalp does hurt. The skull bone doesn't. The brain doesn't. So a surgeon can cut and stimulate your brain while you hold a conversation. Patients name objects, answer questions, sometimes play instruments while their brain is being operated on. And your headaches aren't your brain either. They come from blood vessels, membranes, and muscles around it. Your brain has never once felt itself. So which part feels the most? Not your fingertips, not your lips. It's the cornea, the clear film on the front of your eye. The cornea has 300 to 600 times the nerve density of your skin, around 7,000 pain receptors per square millimeter, 40 times more sensitive than the nerve inside a tooth. And it is almost entirely pain neurons. Detecting damage is essentially its only job. It has no blood supply either, for the same reason as your lens. Light has to get through. So it protects itself the only way left, by being unbearable to touch. A single eyelash under your lid can stop you functioning completely. One cell of damage is enough to register. Meanwhile, a surgeon can cut your intestine and you won't notice. There are people who feel none of this. It's a genetic condition, caused by a mutation in a gene called SCN9A. Their pain signals never reach the brain. It sounds like a superpower. It isn't. Children with it bite through their own tongues. They walk on broken legs. They scald themselves and don't pull away. Many don't survive childhood. Pain isn't a flaw in your design. It's the reason you've made it this far. That's all for today. I'll be making more of these. Subscribe if you want them.